Hello.
How are you doing?
Nice to see you.
Good. Good to see you.
It's been a long time.
Who are you, by the way?
Who am I?
Yeah.
Yes.
Name, rank, and serial number.
Name. Yeah, I was going to say, Jean Valjean. No, I am Ethan Andler. I am the medical director at Advent.
Okay.
And I have been here since 2016. So just had my 8-year anniversary. Hard to believe.
It's a long time.
It is a long time.
Yeah, it seems like a long time, right?
It's actually gone by exceptionally quick, and there's been a massive amount of change, which has been awesome since I got here. So
that's cool. Well, how did you? I feel like I don't know. You've been here long enough. So you're the. Let me think about how I would say this. You're the second longest tenured physician at Advent. Does that sound right?
yeah,
Me. Well, I'd be the longest tenured physician at Advent, I believe, unless there was somebody who preceded me somehow, strangely. But yeah,
right.
So it's, I guess though, but prior to coming, or how did you end up here? Maybe we'll start with that. Here being Advent in Milwaukee, both places.
Right. Yes. Somewhat by luck, to be honest, and kind of a fortuitous journey. So I did all of my training in California, at least for residency. I did my medical school in Milwaukee. So that's my affiliation with Wisconsin, is medical school at the Medical College of Wisconsin. I met my now wife there. She's also a physician. She grew up just north of Milwaukee in a suburb called Mequon. And so her and I couples matched out in California, and we're there for about 8 years doing my primary training, which is ear, nose, and throat, and then did a fellowship in cosmetic surgery. My wife, pediatrics, and then pediatric cardiology, and then another fellowship after that. And our decision point to come home was more related to where we wanted to raise a family. So we had a 1-year-old, 1.5-year-old, and a 6-month-old. And make a long story short, we had some incidences that just kind of really awakened us to the importance of having family around in that community. And so the way that I met you, Madan, is literally, I think we had a bank account with $1,000, like not a lot as residents and just getting started. But we had a banker that I had gotten to know at First Republic, which is no longer now. But anyway, I said, hey, do you guys have any branches out in the Midwest? He said, no, but let me connect you with a friend. And so it was a friend of a friend that I got connected with. She happened to be a patient of Advent's, and she was very praiseworthy of her experience at Advent. It's like, I know a great ENT. You should chat with him. He just opened a new location. And so that's really how it came about. And so you and I had a conversation. I actually remember it vividly. I was in the parking lot at Stanford where my wife was training, and I had my newborn in the back, and he was sleeping, or young kids in the back, and we had a good conversation. And then really it was like, hey, you should come out and see what this is about. At that point in time, you had supported me both, verbally and then with action here about supporting cosmetics. And that's something that I pursued for about 6 to 8 months. And then really the decision point came with, do I want to align more with what Advent's mission is and what we're doing there, or do I want to continue to do cosmetics? And again, had full support and felt full support, but made the decision at that time to jump on board with what we're doing now.
All right. Well, that's a good summary. Let's start at the beginning of that. So you have the unfortunate reality of being born and raised in California. Is this correct?
Exactly. Yeah. I mean, politics aside, it's probably the best state. I'm just kidding.
Is it though?
It's such an amazing, so there's part of California that probably is not as attractive, certainly, but I grew up along the coast of California, which is just spectacular. Okay. And then certainly if you get to inland and Yosemite and Sequoia National, and there's amazing places, but yes, I did grow up in California.
But now you've found yourself though eventually to God's country, which is Wisconsin, correct?
Correct. Yes.
Okay.
And we love it here, So I mean, it's interesting how different phases of life bring out different priorities. Certainly, right? So when I was in med school here, I couldn't wait to leave. It was cold. It's a grind anyway. And so I appreciate it so much differently now that I'm here with family and the community and the people.
Yeah.
So, yeah.
Gotcha. And then you, couple things though. So why ENT? So when you went to, first I'll sort of start here. So you come from a family of physicians, correct?
Correct. Yeah. I'm 5th generation, actually.
5th. So who is the oldest doc? Do you know his name or her name?
I don't. My great-grandfather, his name was Joseph. I don't know his father's name. And then my grandfather was also a physician. And then my dad and 2 uncles are both physicians. This is all on my dad's side of the family.
So how old, the oldest handler doc, whose name will be unspoken here, how long ago are we talking? Are we talking?
Gosh,
I have no idea. Civil War era?
Yeah, that's a good question. Yeah, 100 years plus. So,
okay.
Yeah.
Unfortunately, though, his name it's just forgotten.
He will not be named. Yeah, exactly. I come back and we can make an addendum.
Okay. Well, anyway, all right. So but no other ENTs, and unless mystery Dr. Handler was an ENT, which is possible, but we'll never know. But regardless, I'd say no other ENTs until you. Is this true?
Correct.
All right. And so why ENT?
Good question. So, as you know, there's a decision point in medical school. Do you cut or not cut?
Yep.
And then if you decide that you want to cut, meaning you want to be a surgeon of some sort, I really had no exposure to ENT prior to doing an elective rotation in it during my 3rd year. So, and that really came about because someone was like, hey, why don't you check this out? These people have cool anatomy, good surgery, that kind of stuff. So it was really just doing my 3rd year rotation and being like, this is really cool stuff, and really enjoyed it. And the anatomy is very intricate. Yep. And that's how I ended up in ENT.
Okay. And then you said you guys couples match, so you ended up out in the Bay Area, so back in California, right? And then you did a cosmetics. So for those that aren't aware, so ENT is a surgical specialty. So in medicine, there's surgeons and medical doctors who practice medicine. And we all know that surgeons are better than medical doctors, correct?
Okay, you can edit that part out, Eric.
No, we'll keep it.
Right.
So anyway, so we got the surgeons, you got the good guys, and we got the surgeons and the non-surgeons, to keep it simple. And then the algorithm for you said you're a surgeon. Okay, great. And then ENT, is a surgical specialty, and it just so happens to be the best surgical specialty. So that's obvious too, and it's best because we deal with people from really birth to death. We deal with a fairly limited part of the body, the head and neck, but within that area, we do the best, most coolest surgeries around. And there's not even a question. All other surgeons bow down to us as we walk through the halls. Is this not correct?
That might have been your experience in Oklahoma. Yes, it depends.
We're also known as a pretty dorky specialty, right? We're kind of the pocket protector surgeon kind of crew.
That sounds like more appropriate. I guess it depends on, there's a spectrum and everything, but certainly are we the ortho doc walking around, doing push-ups? No, not necessarily.
No. There's not too many, there's not too many ENT bros, but if there were ENT bros, you might be you'd be in the ENT bro camp, do you think, or not?
Yeah, probably.
Maybe. All right.
That's fair.
But anyway, so you did ENT. So I guess I started it's a 1-year surgical internship, 4 years of residency, doing all sorts of surgeries, ear surgeries and tonsil surgeries, throat surgeries, head and neck surgeries, nose surgery, sinus surgery, so forth and so on. But then after that, you did a cosmetics fellowship. So an additional, was it 1 year fellowship after ENT?
Yep.
And that was cosmetics. So that was full body cosmetics, correct?
Mm-hmm.
And what is, for the people who don't know what that means, what does that mean?
So full body cosmetics being anything it's mainly, as the name says, cosmetics, not reconstruction. And so that was actually something that was encouraged by one of my attendings in residency, who was the facial plastic surgeon, who said, hey, you should explore this. I had a huge exposure to facial plastics in my residency, which is not the same for every program. It depends on where you are and what kind of exposure you get, but felt comfortable with that element. And so he said, why don't you learn what they call kind of breast and body, right? So tummy tucks, liposuction, augmentation, that sort of thing. So, and including face. So about 20% of my fellowship was face related, meaning facelifts, rhinoplasty, brow lifts, eyelids, that kind of thing, as well as chemical peels. So it covered the whole breadth of it. And I think part of it too is in education and really what it's like to run a business also, because, with medicine as it is today, usually most physicians are employed by some sort of hospital group or insurance company, United Healthcare, obviously buying up large medical groups as well. But, the private practice model, it still exists out there, but to a much smaller extent. And there aren't as many new private practices being started now, especially if you're insurance based. And so the cosmetics world really opened my eyes up to what it is to actually be a business owner and try to run a business and market and expand and really entertain this concept that if you're not growing, you're dying, which I think is very true, whether it's personal development in life or in a business, so that's why I really enjoyed the fellowship year.
And you might have said, I think I might have missed it, but as far as, do you remember like specifically why you chose to do, so was there time that your wife was like, were you trying to match up time? Does that make any sense to her fellowship?
Yeah. So part of it was she had 1 year left of her first fellowship. So it was a 3-year fellowship. And so that year and my year overlapped. So that's why I went away for a year. I was still in California. So I was in Rancho Cucamonga, which is a awesome place that's just inland, kind of San Bernardino, so Southern California. And had a great fellowship director. He was very supportive, awesome guy, and so really appreciated that time. But yeah, so Stephanie, my wife, and I matched up our years, and then when I finished, I moved back to the Bay Area.
Okay, and then did you think about, so for those, again, for people who don't know ENT, so after, some people like me, after we finish our ENT residency, go out and go into practice, and then a decent amount of folks like you, after you finish your ENT residency, you'll go off and do a fellowship in cosmetics, facial plastics, head and neck, otology, which is ear surgery, laryngology, which is voice, rhinology, which is nose and sinus. So did you know you were going to, did you know that you wanted to do a fellowship, or didn't know that, or figured it out at some point?
That's a good question. I knew that I wanted to do a fellowship, yes, and initially looked at facial plastics, which is the more traditional route within my specialty, just simply, just face. Yeah. And honestly, applied and didn't match. And one of the reasons why I didn't match is I had a very limited number of places that I was willing to go for that year. Yeah. And that was just a decision point in my life, and being away from my wife and getting close to wanting to start a family and that sort of thing. And so that opened the door for an opportunity with the Cosmetic Surgery Fellowship, which I had never even considered. And so got to learn an entire new skill set doing that. So.
Gotcha. And again, just for those that don't, so cosmetic surgery, so the kind of docs that can do a cosmetic surgery fellowship are ENTs, general surgeons, oral surgeons.
Correct.
So it's sort of there's a few different pathways that go in that direction. And then coming out of that fellowship, did you have a clear sense as to what you wanted to do thereafter? Like, meaning, I'm going to do cosmetics, I'm going to do ENT, I'm going to do XYZ.
Yeah, so I knew I was going to do some ENT as far as supporting kind of our new budding family. But at the same time, too, had started to engage in conversations with people in Northern California about joining their practice and doing cosmetics. And so just the way that things kind of played out when we made the decision to come back to Wisconsin, hadn't officially joined a cosmetics or plastic surgery practice at that point in time. And then we decided to move. So I was working for the place where I did my residency, which is in Kaiser Permanente in Oakland, California. Was part of the department there, operating, seeing patients, doing the whole kind of gamut there, and was offered a job there and decided not to stay just because, again, Stephanie and I wanted to move our family to the Midwest, be closer to family, and that sort of thing. So
yeah. No, it makes sense. And then I know you said it out of the gate, but yeah, I mean, in addition, I don't know if we should say her name or not. So we'll leave her with your great Dr. Handler, or her name will be unmentioned possibly, but her initials I believe are JK. So JK, I don't know why we wouldn't mention her name, but we just won't. Anyway, well, one is she's a patient, so that's probably a good reason not to mention her. But I actually you being at Advent is actually due to my eldest child being at St. Joe's school. What's the name of it? So my eldest kiddo and her eldest son were in the same kindergarten class at St. Joe's. That's why. That's actually that's why we're sitting here today. I guess I was thinking about this morning, meaning that if that wasn't true, then I would never met her. And it was, I do remember when you sent an email to her and she emailed me, and same thing.
You saved that email, printed it out, and bronzed it, right?
I have.
Is it framed on your wall?
I have. I could unearth that email. I could go into the vaults, my email vaults that I keep.
Well, because your inbox is exceptionally clean and it's impressive. Right? Yes,
inbox zero. Thank you.
Right.
Thank you.
Okay,
but I have everything where it needs to be, in a very psychotic way. So I always keep track of everything. So anyway, so that fast forwarded you, and just to be clear for all, everybody who's listening, I was not looking for you at all, correct? We were not. Advent was happily humming along, weren't looking to add any docs. Life was good. I'm just telling you from my side. Mm-hmm. And then you showed up on the doorstep. That's about right?
Yeah, we had dinner, and it was you and Gwen and Tamira at that point in time, and had a great meal. And then the next day showed up at clinic and shadowed, and made sense. So
yeah. And so I think, just not that everybody actually cares about all these details, but I would say there wasn't any particular grand plan. And I think how I viewed it back in this is 2015. I mean, I know you started in 2016, but this would have been like probably 2015, 2016.
Yeah.
Something like that. But it was really just, the concept with bringing you on board was, to come on board at that point. The Advent was a practice that had just opened our second location. So we started in 2004, had one location for 10 years, and then opened a second location. And then, you came in 2016. But the thought process was basically come on board, do some of the ENT stuff that we're doing, and then eventually maybe, start doing some some of the cosmetic work. That was the plan. And I think, by my recollection, you came in and it was really started to see and do some of basically kind of my overflow patients that I just, I didn't have, I wasn't able to get in a timely manner. And so you started seeing some of those folks, correct? And I think that's, in my mind, that's sort of one thing led to another, which means that you started to do the stuff that we do here at Advent, which, just to be clear, is stuff that you didn't learn in any of your residency or your fellowship, and I didn't learn in my residency. Meaning, all these office procedures, they still to this day are not taught in ENT residencies. That's correct?
Yeah. No, I mean that's definitely a true assessment, and I do remember there's multiple reasons why I joined, and part of it was just also trusting my gut, but and intuition. But when most people join a private practice, it's kind of an eat what you kill model, and you aren't necessarily given patients, and you have to go kind of fight for patients. Not necessarily in a bad way, but that's just a traditional model. And I do remember you saying to me that you needed me to take volume from you, and there was an intention around that. Honestly, and that's what got me really busy, and that's so different than what is seen in typical private practice or when somebody joins. And so, I appreciate that to this day, but that was a kind of key component. Okay, this person obviously is serious about wanting to have me be successful within the practice as well and treat patients. So anyway.
Gotcha. And then you basically started doing what I was doing at that point. And just so everybody, I mean, at that point, Advent, for those that aren't aware, Advent is short for Advanced Ear, Nose, and Throat Specialists. And so, we were doing the full spectrum of ENT, mostly focused on nose and sinus work, the stuff that we're known, for to this day. But, doing and doing quite a bit of in-office work. So procedures in the nose, procedures in the sinuses that we do under local anesthesia, which again, stuff that, you don't get exposed to in residency. So, I guess I'm just trying to put myself back in that era too. And it wasn't certainly no grand plan. It was more of a, here's what we do here, go ahead and give it a shot and see how things go. And I think basically over the course of those first 6 months, it was you kind of gradually understanding, we'll just make it simple, understanding the power of what we were able to do from a procedure standpoint, both in the office and then in the operating room in that day and age, which basically by the time the clock ticked to, all right, are we ready to start this cosmetics thing? Because I remember this conversation too, which was, all right, we had, you did some glamour shot, correct? Can you tell me about the glamour shots episode?
Yeah, exactly. Right. So, no, I mean, you and the team threw marketing dollars behind an effort to market myself and some of our PAs. And, Dr. Rossiter also, who was a surgeon who retired there shortly after, was part of that as well. And so, again, the intention was good and you guys backed up what you said. But when push came to shove in a way of like, what are we doing with Advent and what's the vision here? And I was having a lot of fun doing the in-office procedures and seeing awesome results for patients. And it was new for me, as you said, because it did not learn this in residency. Didn't even know that these things could have the impact that they did on patients. So it was this positive reinforcement that I'd see all these happy patients and I'd be like, I can't believe that what we're doing here is having these types of results for patients because we're so programmed to do big surgeries, et cetera. And so supported it and was willing to leave, cosmetics behind, from that regard. So,
yeah. And I think, and then we basically, before we even launched that cosmetics program, we shut it down. I think there was some sort of mediocre, like, I feel like we were doing a little bit of there. You were doing, I wasn't doing it, but I feel like we're doing a little bit of that for a bit. But then, I think from, moving in a forward direction from there, it was simply then, one step at a time, marching, in a forward direction. Again, there was no grand plan coming into it, but I would say you were sort of surgeon, whatever, zero, surgeon one, whatever you call the first, case of passing along, that there's sort of how I learned to do what I do. And the limited nature of that, meaning I could only help as many people as I could personally see, even with PAs and nurse practitioners. But then, you coming on board, again, no grand plan, but it was like, okay, just learn what I'm doing here and learn by doing. And then it was like, oh, okay, now this is sort of like, there's a different rhythm here, and this is kind of interesting. And from the first day you started, we had PAs here, and so we've always had a relative team-based approach, but that was sort of part of it too. So I would say kind of your early era here was you learning how to do what I was doing, and then me learning what it meant to have somebody else here doing, sort of parallel work to what I was doing. And then, me at that point starting to try to think about, okay, we've got basically at the end of the day, it's what you saw firsthand is what I've seen throughout my career, which is these simple things that we can do. I actually thought about this in residency. Was that when I was a resident, when we did ear tubes and tonsils, ear tubes and tonsils and adenoids. Those are simple, easy surgeries, but the impact of those things were profound. And I always enjoyed that. Like, I enjoyed the gratification of seeing those happy kids and parents in that scenario more than I did the big whacks. Like in ENT, there's the big whacks, which is big head and neck cancer surgeries that can take a day or more. I mean, literally
Yeah.
when I was in med school, some of these surgeries lasted like literally 36 hours, kind of a thing. And a lot of people gravitate towards ENT because they like that kind of stuff. And I feel like I gravitated towards ENT because I like to help people. I mean, I like to do things to help people. And long story short, I'd say for kind of that part of your journey, my journey, Advent's journey, it was kind of this discovery phase of, wow, as gratifying as it is to me to help people with my hands, it's also gratifying if somebody else is doing similar work, not necessarily carbon copy, but similar. And yeah, and I guess really, long story short, one foot in front of another between then and now is sort of just trying to expand upon that. Not just, I mean, from an organization standpoint, but obviously for you as a physician who's now evolved into becoming a physician executive, a leader in this organization as well. It's sort of been an interesting journey, correct?
Yeah, I mean, it's been a fascinating journey. And for me, doing the procedures that we do really is, because we're very focused, right? We're very niche within our specialty. And so there's a small slice of things that we do, and we do them a lot, which helps us practice at the top of our degree within that specialty. But more importantly, that to me is meditative, so again, there's a flow state with doing those types of procedures with patients. And then, again, outcomes fortunately are good, which we track, right? Like we wouldn't be doing what we're doing and we couldn't grow like we're growing if it didn't have results, like period, and then the other element to this too, from a physician executive standpoint, is it's really awesome to see other surgeons who have had different arcs in their career come on board at Advent and realize the same things that I realized when the light bulb went off, right? Mm-hmm. So early on in my journey where I'm like, this isn't what I was taught and this isn't how I was instructed to kind of necessarily think about things. But when you see it with your own eyes and you do it with your own hands and you see it over and over again, that's that light bulb moment. And I get to see other people have that light bulb moment, whether they've been practicing for 20 years and then join Advent or they're a couple years out of residency, and so that's a really awesome experience. And something that I am very proud of as an organization is, and then there's burnout in every specialty and things like that. But for people that kind of have sometimes a revival of their career here, mm-hmm. Because they're learning something new and it's a new skill set and it's expanding their horizons when it comes to, procedures and how they think about things. But so that's a really neat experience.
Yeah, and it's cool. And you're not, I mean, again, how many surgeons do we have currently? So we talked about you being sort of the...
I know, this is a test. God, what are we at
roughly
now? I want to say somewhere between 16 and 18,
like
always
that.
moving parts.
Yeah,
so,
and we have like half surgeons, so it's hard to know. We actually have whole surgeons. We're growing so fast, though, it's hard to keep track of all the folks we have here. So yeah, I think that sounds to me about right. Like 18 surgeons. I think we've got, we'll call it 60 or so medical ENTs, which are PAs and nurse practitioners. And so you, in addition to being a surgeon here at Advent, are also the director of medical affairs here at Advent, which means that you oversee this medical staff. So I think kind of our time, I believe, is coming short to a close here. So we'll kind of wrap it up. But I think maybe in an episode upcoming here, we'll talk about some of these other sort of angles on things, including just sort of both. I know we touched on Advent, kind of where it came from, but maybe some of that and some more. So anything else to add in our last bit of time here?
No, it's been a heck of a journey, and we're only getting started. So,
all right, and we will be back. I think you, unless I take the invite away, I think you will be back for our next episode here. But I am pondering taking the invite away. So we'll see.
Frees up more time for me.
All right.
Thank you,
All right, until next time.
Okay.
Adios.